Alright, so I've walked into the scene. The scene is safe. There's no obvious dangers to myself or the patient. I've got the appropriate PPE on. I'm using standard precautions today, so I've got my gloves and my safety glasses on. Hi there, buddy. How are you going?
Yeah, look, I've been better. I've just had this congestive type cough for the last 3 to 4 days, and yeah, I get a bit of seasonal asthma, and I'm just not getting any better.
Okay, no worries. Can I ask your name?
My name is Milton.
Milton? Alright, so you're happy for me to call you Milton today?
Yep, that's fine.
Alright, awesome. So the patient is sitting upright already. Are you comfortable in that position?
Yeah, I breathe much better sitting up. In fact, I use 3 to 4 pillows during the night in the last few nights just so I can breathe better.
Alright, no worries. So we'll leave you in that position if you're comfortable. The patient's chest is already exposed, so just looking at their chest, their breathing seems to be regular. They're not breathing deep or shallow. They're not breathing fast or slow either, so they don't look to be in any severe respiratory distress at the moment. They're not in the tripod position. They're not using any accessory muscles like their scalene muscles. Do you mind if I just have a look at your hands?
Not at all.
Cool. So I'm just looking at their hands. No evidence of clubbing or peripheral cyanosis. Looking at the face, they don't have pursed lips, which could indicate that they're struggling to breathe a little bit. Milton is able to talk to me in full sentences as well, so that's a good sign. I'm just going to have a feel of your skin. So his temperature feels quite good. He's not pale or cyanotic either, so that's a good indication. Looking around me, there's no evidence of home oxygen. Are you on any medications at all?
Just a little bit of Ventolin for seasonal asthma from time to time, as I had a bit of bronchitis as a child as well.
Okay, so you've had episodes of bronchitis, is that right?
Only as a child.
As a child, and you haven't had any since?
No. I've had little past history of smoking, and yeah, I just get a bit of seasonal asthma. Yeah.
Alright, no worries. Have you got a cough at all?
I do, and I'm coughing up this thick, brown, yucky stuff.
Alright. Have you got a wheeze as well while you're coughing?
When after I've coughed, I try and clear my throat. I get a bit of a wheeze, and then it just goes.
Okay, no worries. So if you don't mind, I'm just going to have a quick look at your chest. So the patient's shirt is already off. I'm just going to have a listen to their respiratory rate for about 30 seconds. And their respiratory rate is quite good. It's 16 breaths per minute, so that's within normal ranges. They've got symmetrical rise and fall. They don't have a barrel-shaped chest or a chest that looks as though they're affected with pectus excavatum or pectus carinatum. You haven't had any previous thoracic operations or chest strains or anything like that?
No, nothing like that.
No? Okay, cool. And I can't see any scars or wounds or bruising or evidence of a pacemaker either. I'm just going to have a quick feel of your chest and just let me know if there's any chest pain or tenderness as I'm doing this, okay?
A little bit of pain when I breathe
Just
out, but when you touch, there's nothing there.
Okay. So nothing over this side either?
No, nothing.
Alright, cool. And just take a deep breath in and out for me.
Yeah, it hurts to take a deep breath in.
So it hurts when you inhale?
Yep.
The pain gets worse?
Yep.
Alright, no worries. Just going to have a quick feel. And that sounds all pretty normal. At this point, I'm not suspecting anything like a pneumothorax. Just going to have a quick listen to your chest. So I'm listening to his lung fields. Just breathing in and out normally for me. Alright, and do you mind leaning forward for me just so I can have a listen to the back?
Not at all.
Sorry. And last one. Alright, cool. Just sitting back again for me. So on your right side, you do actually sound a little bit congested. So you've got a couple of options. We can take you up to the hospital where they can do some further investigations. You may need to get on some antibiotics or something like that if they find you've got an infection or something like that going on. Otherwise, we can refer you to your GP, but we would recommend that you do come up just for a quick trip to the hospital and get everything checked out.
Yeah, yeah, that'd be good. I'll be happy with that. I think when you mention antibiotics, getting on top of things is imperative.
Yeah, definitely. All right, so we'll take you up to hospital.
Excellent.